I welcome the very well-known Dr. Rajni Sao, ma'am. She is senior gynecologist in Raipur, and she is director of Karma Hospital, Raipur. And she was the past president of ROGS in 2008 to 2010, and she was the past vice president of IMA Raipur in 2008 to 2009. So I welcome you, ma'am.
Thank you so much for that introduction. And my topic is actually the topic of evening and late night. But alcohol की बात अपन सुबेरे सुबेरे नहीं करते हैं, but I have to do it.
But we can start, ma'am.
Yeah, thank you. So, topic today is alcohol in midlife women. And it is a quiet risk. It is a silent risk. Thanks for that introduction. And you're all well versed with this picture of Meena Kumari. She was in late midlife. She became addicted to alcohol, and she had very sad end of the life. So this alcohol is a hidden epidemic. For many women, the alcohol takes on a more central role in midlife. And we, the gynecologists, are the front lines in treating the midlife woman. And this alcohol, this risk factor, is often overlooked in the perimenopausal health. So we have to take care of this. In the recent studies shows that this alcohol addiction and occasional drinking of the alcohol, which is known as single occasional risky drinking and long-term risky drinking, this was less than 5% in 2005. But now, in 2026, it has been more than 15%. So what are the triggers? The triggers are the mental load, the menopause symptoms, the emptiness syndrome, and the isolation. So the managing the demanding career, supporting aging parents, and launching children, it creates a lot of mental load in midlife. The onset of the menopausal symptoms, the people try to self-medicate. The women try to self-medicate themselves, and also they find the treatment in insomnia and anxiety. The treatment, they take it as alcohol. Again, a photo of alcohol and a beautiful lady, Priyanka Chopra. So the culture has shifted to the wine o'clock. The drinking has become highly normalized and socially acceptable among women. Increasing financial freedom and evolving gender roles have erased the previous stigma कि females को नहीं पीना है. And the targeted marketing also comes कि mummy wine culture is there, and it is necessary tool for survival of the day-to-day life. But between male and female, there is a difference of biology and the metabolism of alcohol. And the identical consumption yield drastically different physiological consequences. This is very important slide because I was not knowing कि male and female में there is a lot of difference, because as the female have a lower body water, women naturally possesses less total body water and more body fat. And alcohol is highly water soluble. Less water means the alcohol is less diluted in the women body. Women have lower level of the gastric alcohol, dehydrogenase. That means it is broken down less in the stomach. And that is why the more alcohol enters a woman's bloodstream, leading to the faster intoxication and higher tissue toxicity. For the exact same weight and quantity of alcohol consumed, a woman's blood alcohol concentration will be significantly higher, increasing the immediate and long-term risk to her organ. And the alcohol and the menopause, they form a vicious cycle. They exacerbate the vasomotor symptoms and the sleep symptoms. Alcohol, we know, it dilates the blood vessel, and it is a documented trigger for severe vasomotor symptoms. It causes the sleep disruptions, and initially when you take alcohol, there is a sedative effect aiding the sleep onset, but it drastically reduces the REM sleep and causes midnight awakening. Mood swings are well known with alcohol. So, what are the effects of addiction in midlife? It causes psychosocial, cognitive, and physical effects. Psychosocial, like it deteriorates the family relationship, professional decline is there, and profound social isolation hidden behind the closed doors. It accelerates the brain volume loss. Alcohol heavily exacerbates the midlife brain fog and memory issues linked with the estrogen decline. And women experience a faster progression from first drink to alcohol dependence and severe organ damage. And beyond the reproductive system, the organ specific damage is also there. So, regarding the cardiovascular system, alcohol is the leading preventable cause of the cardiovascular disease in women. Women are more susceptible to alcohol-induced cardiomyopathy. And this I also knew for the first time when I was making these slides. And directly correlated with the treatment-resistant hypertension. Those taking alcohol become resistant to the treatment of the hypertension. And there is an increased risk of the atrial fibrillation. Regarding hepatic system, women develop alcohol-related liver disease over a shorter period of time with less consumption compared to women. तो men को copy नहीं करना है. And estrogen increases the oxidative stress in the liver, and it accelerates the progression from fatty liver to the alcoholic hepatitis and eventually deadly cirrhosis. In kidneys, alcohol inhibits the antidiuretic hormone, leading to severe dehydration. And chronic use causes fluid and electrolyte imbalance, leading to acute kidney injury. Now the breast cancer risk, it increases by 14%. It is very remarkable. So there is a strong linear dose response relationship. So how to screen them? We have to assess, we have to advise, we have to assist, and we have to arrange for them. So how to assess? We in the routine, our OPD, we have to do a screening of during our perimenopausal consultations. We have to advise on specifically on the risk of the breast cancer, bone density loss, and the cardiovascular health. And assist, treat the root cause for the vasomotor system symptoms, sleep aid therapy, and if they become a chronic alcoholic, we have to refer for the specialized addiction support or psychiatric care if they are dependent. So, this is the power of the intervention, and our role is critical because gynecologists are often the only physician a midlife woman sees regularly. So, alcohol use disorder is a profound medical, it causes medical vulnerability, not a moral failing, as clinician, we must break the silence and start speaking about that, start screening the patient, start asking the patient. And the risk of alcohol in midlife women may be quite, but our screening, intervention, and compassion must be loud and decisive. With that, I thanks you all for a patient hearing, and again, cheers.
Yeah. Thank you, Dr. Rajni, for the cheers for our conference. And it was a wonderful lecture. But we should note that vicious cycle, when the socializing drinks becomes an addictive drink. And that is where we
Tabassum.
have to be alert and try to stop that cycle. Thank you very much.
Thank you, ma'am. I want to invite chairpersons for next session, Dr. Manika Agrawal, Director, Devi Lakshmi Hospital, Dr. Sheila Jan, ma'am, President, NARCH